Welcome to On the Beat, everyone. I'm Troy Thompson. Today I'm joined by Dr. Richard Hurd of Gastroenterology Associates of Columbus, and today we're talking all about how did he get into the business, what it is that he loves about the business, and also his practice and here in Mississippi. Welcome to the show, my friend.
Thank you, Troy.
Doctor, you've been doing this for a couple of years now with me, and I just want everyone to sort of reevaluate how they get to know you and why it is that you got into this type of business to begin with.
Yeah.
And this form of medicine, really.
Yeah. Well, believe it or not, gastroenterology is actually a great job. I get that question all the time, usually right before we put somebody to sleep for their procedure. They're like, why are you doing this? But it is a very rewarding job. The hours are good. It's a lifestyle kind of
And
thing.
when you say lifestyle, why did you choose Mississippi to build your practice here?
I'm from Mississippi. I'm from just a little bit down the road from here in Brooksville. It's a little bitty town, no red lights, a four-way stop. So this was home for me. So
when you decided to open the practice, and you have a couple of different partners there now as well, how's it been going, and is it something that you're looking to get even bigger and maybe expand?
Well, we're trying to maintain our size right now.
You've got a pretty big practice, though.
We do. There are 5 gastro doctors there now. One is retiring, one is joining soon. And we've been having a lot of patients recently. I guess the show's been successful, Troy.
Well, that's good. I like to hear that. Well, I want to talk to you a little bit about the process of being a patient at the clinic as well. So is it something that I would be referred to from my local GP, or I'm self-diagnosing and calling you?
Both. And I'm glad you asked that. That's a common question too. You can be referred, of course, from your regular doctor, but you don't have to be referred. If you're having a stomach problem, you can call us and ask for an appointment. We'll get you in.
Well, I wish I'd known that, because remember, I had those stomach issues and went to my GP and he's like, oh, you're fine. Yeah. Well, we had major problems. When you go through that process, are we doing all our tests within your clinic, or are you sending us out somewhere else?
So some tests, like some simple blood work, we can do in our clinic. When we do all of our procedures, our colonoscopy, our upper scope, we do that in our clinic in Columbus. But we have clinics in Columbus and Starkville. So if we see you in Columbus, you'll be getting, CAT scans and that sort of stuff at either the imaging center or the hospital. In Starkville, there's also an imaging center in the hospital there. So those type tests, you'll be sent out from us for those.
I want to just touch on gastroenterology as a whole. Now, we all know colonoscopies. Mm-hmm. What are some of the other things that people may be experiencing that they need to see a doctor like you and your team?
Yeah, everybody thinks of colonoscopy when they think of gastroenterology.
And that's all they think of.
Right. But we also handle liver issues, pancreas issues, heartburn. We also go down the throat and look in the stomach there. Stomach pain is a common thing that we deal with. Difficulty swallowing.
Where do you see the state of Mississippi when it comes to colon cancer and these type of things that we need to see you about? Where do we sit in the rest of America with our health?
Yeah,
colon health, I should say. We
are not doing very well for colon cancer screening. We have one of the lowest rates of colon cancer screening in the country.
Really?
Yeah, we need to do a better job.
It's all about our lifestyle, really, though, don't you think?
Well, yeah, I mean, lifestyle plays a big part in that. People don't, for whatever reason here, we just need to do a better job of education about
well, hopefully we're helping.
Yeah, I hope so, too. That's the point of being here.
We appreciate you.
Thank you, Troy.
If you want to find out more information, there it all is up on the screen for you. Dr. Richard Hurd from Gastroenterology Associates. We'll be back after this short break.